One second. A 68-year-old man is brought to the emergency department because of 2-day history of progressive lethargy and tremor. He has alcoholism and opioid, cocaine, amphetamine, and alcohol use disorder, but he has abstained from alcohol and illicit substance during the past 2 weeks. He also has alcoholic cirrhosis. His only medication is daily multivitamin. He previously drank 6 12 oz beers daily. He appears chronically ill and his salmonal temperature is 98.2 degrees Fahrenheit, pulse 100 per minute, respiration 18 per minute, blood pressure 100 by 60 millimeter of mercury, pulse oximeter on room air shows oxygen saturation is 94%. Examination show conjunctival icterus ascites and ductus edema of the lower extremity cranial nerves are intact. Muscle strength 4 by 5 throughout. When he is awake, there is postural and action tremor of the forearms and hands that is accompanied by sudden brief loss of muscle strength. His speech is normal. He is able to follow simple commands. Serum total bilirubin is 3 mg per deciliter. Blood and urine samples show no pathogens. Which of the following is the most likely to improve this patient's cognition and movement disorder? Ready?
Mm, yeah,
Okay.
sorry. I didn't even. Okay, so is C lactulo? Oh my God, I'm looking at the other one. While you may have initially been thinking of alcohol withdrawal, the case presents you with signs and symptoms of decompensated cirrhosis, including hepatic encephalopathy from hyperammonemia, alternate metastasis, asteresis. Treatment is oral lactulose which help clear ammonia via the power of horrible diarrhea, I guess. Okay,
Okay.
next.
So it is ascites, so oral lactulose is the therapy. Okay. A 45-year-old woman comes to the emergency department because of 3-day history of progressive shortness of breath, cough, productive blood, tinged sputum, and fever. She also has 3 months history of numbness of her left leg and in her tingling in her right arm. She has not had chills. She was diagnosed with asthma 6 months ago. It is well controlled with inhaled budesonide and albuterol as needed. She has no history of serious illness, takes no medications. She appears to be in mild respiratory distress, temperature 38.1, pulse 105 per minute and regular respiration 24 per minute, blood pressure 145 by 95, pulse oximeter on room air show oxygen saturation 92%. Crackles are heard on the right lung base and there are occasional diffuse wheezes. Cardiac examination shows no abnormal or neurological examination. Sensation to pinprick is decreased over the lateral aspect of the left lower extremity and right upper extremity. Muscle strength 5 by 5. Babinski sign is absent. Deep tendon reflex is 2 plus and symmetric. Which of the following is the most appropriate next step in the management? Are you thinking about PSGN?
SGN. Mm,
Antiglobular or good pasture?
Nothing of it's going on.
What is your thought?
Not PSGN.
But
This
she has, sorry, not so, she has shortness of breath. She has asthma, eosinophilia.
she has shortness of breath. She has asthma. Okay.
She has intractable type of asthma, like inhaled
Intractable type of asthma.
asthma, numbness. Is it any sort of vasculitis? Isn't it?
I I thought it was like either the antibodies that attack the yeah,
Like you are thinking about
either
Alport, good pasture,
the good pasteur or the alpha. That's what I was thinking about.
or is it
But
anything
it
else?
doesn't,
But asthma and the good pasture do not have the asthma.
doesn't
Sorry,
make me-
these do
yeah,
not. Asthma comes
it
with
doesn't.
Sharp-Strauss syndrome, isn't it?
Mm-hmm.
Mm, So is Anka
Ready?
is possible.
Oh,
Okay, let's see.
okay. It's F. F is what? Wait, let me see. It's like
Sweat chloride. Oh,
serum anti-neutrophil cytoplasmic antibody assay.
Anka.
Also ANCA, serum ANCA. Keep in mind that not all wheezes is asthma. Wheezing is a sign of obstructive lung disease, not a diagnostic failure. So consider asthma alternatives in adults. Hemoptysis and fever help change the game. Eosinophilic short strokes and granulomatous Wegener, both cause lung disease. Do you know they can also cause peripheral neuropathy? The former over the latter commonly has uh, the former over the latter commonly has neuropathy and presents with asthma. What's the former? Like short strokes? Okay, I guess it's short
Yes.
stroke. Presents with asthma, but the latter can easily do the same. ANCA can be positive in both and bed and helps confirm the diagnosis of vasculitis if it's unifying. So chalk straws was the one that has upper um,
Asthma with eosinophilia. Initially, it is called. Previously, it calls Sharp-Strauss syndrome. Now it is called EGPA, isn't it?
is
And
it the one that
EGPA
has
and Wegener. Wegener granulomatosis. Think about C, sinusitis, lungs, and kidney. The Wegener. But Sharp-Strauss and the like EGPA, it comes with asthma, eosinophilia, like lungs symptom. Both
okay, so okay.
EGPA maybe sorry Wagner Wagner granulomatosis is P-ANCA positive and the Shark-Strauss is C-ANCA positive antineutrophil cytoplasma entered. You got it? And it comes with peripheral neuropathy.
Uh-huh.
There are features of peripheral neuropathy. That is the thing actually distracting. We have found that this patient has asthma and there is like sputum, blood with sputum. But problem here, there is tingling and in her right arm. That is the most important distracting part. You got it?
Okay.
Is there anything else you want to add?
No.
Okay, let's jump on next.
I don't like this that this explanation don't have the why the other one is wrong.
Then we have we have chat gpt, you can copy, you can paste. So I am
Oh,
looking for that. We now we have plenty of option. No need to worry. Previously people are so messed up, like this, like you, people are getting this answer from the scribe, you know that.
mm-hmm.
Okay, Let's evaluate the option. I'm evaluating the option. The
What option?
city and geography. Which option you want to? This all
Oh,
the
I was confused between the. No, but I got it now for that one. I just was confused between the
you are
anti-government.
confused with like option
Yeah.
E and F,
E,
isn't it?
ENF, uh-huh.
Okay. E used to diagnose Gupta syndrome, which causes rapidly progressive glomerulonephritis and pulmonary hemorrhage. This is a strong possibility given the hemoptysis. This is one of the strongest possibility, but there is no glomerulonephritis, isn't it?
Yeah, yeah.
And which option? The F.
No, F is the answer. I got it. It was E. E that I was confused about. F is the answer.
Okay, so you got it now.
Mm-hmm.
Okay, next. So any question you are confused, just copy and paste.
Mm-hmm.
An 87-year-old woman, gravitas 6, para 6, is brought to the emergency department. Is brought to the emergency department because of 24-hour history of severe abdominal pain and inability to avoid. She notes that for the past 2 months he has difficulty emptying bladder, especially at the end of the day. 24 years ago, she underwent mastectomy for breast cancer. She has been cancer free since then. She has 10-year history of osteoporosis. All of her children were delivered vaginally without complication. Her only medication is alendronate. Examination shows the cervix protruding 7.5 centimeter from the vagina. After the cervix is replaced into the vagina, drains a urinary catheter drains 700 ml of urine. Urine analysis show no abnormality. Which of the following most likely diagnosis? Is it retention, isn't it?
Yeah. Okay, so
Okay, ready.
right. So it's oh my god, and here I have to see urinary retention due to pelvic organ prolapse. Multiple vaginal deliveries are a risk factor. That's it. That's the
Yes, gravida 6, para 6. So
okay.
urinary retention. Okay,
Next.
next. A 25-year-old woman, a 25-year-old woman is admitted to the hospital because of 2-day history of fever, dizziness, lightheadedness, chills, and shaking. She has hyperthyroidism, GERD, asthma. Her medications are oral methimazole, omeprazole, inhaled fluticasone. She has been the same doses. She has been on the same doses for a year. She is in the military reserve and will be deployed overseas next week. She began attachment program 1 week ago and received the hepatitis A and yellow fever vaccine 2 weeks ago. She is not sexually active. She does not smoke cigarettes and drinks alcohol. She appears ill, but is not acute distress. Temperature is 101.5. Pulse is 110. Respiration 22. Blood pressure 90 by 60. No wheezing is heard on auscultation. Cardiac examination. Hemoglobin 13. Leukocyte is low, 1100. Segmented neutrophil is low. Eosinophil high. Lymphocyte monocyte is high. Platelet count 3 lakh 20,000. Which of the results of the other preference, which of the following is the most likely cause of this patient's hematologic abnormality? Isn't it neutropenia?
Mhm.
And she is on hyperthyroid med, isn't it?
Mhm.
So is it methimazole?
I think so
Methimazole can cause a neutropenia, granulocytosis.
too. Yep. Let's see. So yes, this patient has neutropenic fever. Methimazole can cause a granulocytosis. Mm.
Next,
Yep.
a 16-year-old boy is brought to the emergency department because of 2 days history of fever, nausea, vomiting, 2 day history of fever, nausea, vomiting, headache, chills, and fatigue. He has not had he has not had any sick contacts. He underwent splenectomy for traumatic injury at the age of 13 years. He has no history of serious illness, takes no medication. He appears ill. His temperature is 102.5 degree Fahrenheit. Pulse is 130 per minute, respiration 14 per minute. Blood pressure 110/60. Pulmonary examination scattered crackles are heard bilaterally. Abdominal examination shows well healed well healed midline scar and a mild diffuse tenderness to palpation. Which of the following is the most appropriate next step in the management? He underwent splenectomy. Ready? Is it
Mm,
antibiotic? Splenectomy patient comes with fever. Immediately give antibiotic because the streptococcus, these antibiotic can kill you.
it is concerning for me. A is a concerning for meningitis. Yes, even with abdominal pain, which can be so severe that it can mimic appendicitis. Remember that splenectomy status predisposes to infection with encapsulated organisms like meningococcus. This may also be purposefully vague, as in real life, this will also certainly be an abdominal process like actual appendicitis, for which you might get an appendix ultrasound or CT of the abdomen in addition to starting empiric antibiotic. But that's not an answer choice. Okay.
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 A previously healthy 29-year-old woman hospital is admitted to the hospital because of 1 day history of moderate headache, fever and lethargy. Moderate headache, fever and lethargy. 2 days ago, she underwent wisdom tooth extraction. She takes no medication. She cannot remember the vaccination history. She does not smoke cigarettes, drink alcohol, or illicit drugs. She is a college student, lives in an apartment complex with other students, and eats all her meals in the campus dining hall. She says her study partner had a really bad fever during the past week. The patient appears sleepy, temperature is 104, pulse 140 per minute, blood pressure 90 by 40. Examination shows a diffuse purpuric rash over the trunk and all the extremity. There is nuchal rigidity. Lungs are clear, hearts are normal, neurologic show no focal. Which of the following is the most likely to have prevented this current condition? Prophylactic antibiotic. Meningococcal meningitis, isn't it?
Mm-hmm.
Or is it isolation? Or is it
Ready?
yes?
So it
We all are
is
wrong.
A. Is A. She should have had what adherence to immunization guidelines. Also meningitis. There is a vaccine for that, which everyone in college is supposed to get. Okay, so it's A.
So adherence to immunization guideline, like every student in the college should be vaccinated against meningococcal meningitis.
Hmm. You see, that's why I don't like why not prophylactic antibiotics
Okay,
heard.
let's see. No problem. We have apps, so we can see.
So
Not to
the other answer and explanation doesn't have all this, doesn't have that.
now we can make this thing also. We can copy and we can paste here. We can make our own answer if you want. People are doing this. Okay, which option you want to hear? Which
Uh,
answer?
E.
Prophylactic antibiotic. Prophylactic antibiotics are given to close contact after an exposure to a confirmed case to prevent the secondary cause. It is not a general preventive measure for the entire student population
Okay.
or for someone who hasn't been identified as a close contact of a diagnosed kid. It is a post-exposure intervention, not a primary intervention, not a primary prevention strategy in this context. You got it?
Okay. Next.
7. A 27-year-old primary gravid woman comes to the physician for her first prenatal visit 10 weeks after a home pregnancy test was positive. She feels well and her pregnancy has been uncomplicated. She previously used oral contraceptive but discontinued 3 months ago. She has no history of STD. She is sexually active in a monogamous relationship with a male partner who is the father. She has 5 lifetime sexual partners. She has a pet cat. Examination shows uterus consistent with size with 10 weeks of gestation. Testing for which of the following infectious condition is most appropriate recommendation for this patient. Is it HIV? Yes. Let's see.
HIV. No, wrong thing. Wrong place. Every pregnant patient gets tested for HIV during routine initial prenatal workup testing, as well as again during the third trimester. So first and third trimester. Um, yeah, it's not. What was the other one? HPV. Routine testing and initial visit, urine and protein culture, chlamydia, PCR, Rh, antigen, antibody, whatever, hemoglobin, hematocrit, Hep B, rubella, varicella, and pap test if it's indicated. If it's indicated. At 24, 28 weeks, the Rh antibody screening and diabetes. And then at 35, 37, group B strep.
Okay.
Next.
Yes, an investigator would like to decrease the incidence of type 2 diabetes mellitus among adult patients with the risk factor including obesity, decreased physical activity, family history of diabetes mellitus. A total 200 men and women aged 30 to 64 will be enrolled in the regular exercise program for 6 months. A nurse reviews the details of the study with each participant. The detail of the study with each participant, and each participant signs an informed consent form. 1 month after the study begins, one of the participants asks to drop out of the study. Which of the following represents the most appropriate next step in the study participant?
Ready?
Yes.
Wrong one. It is quitter's gonna. Oh my God, quitter's gonna quit. So it's E.
Can you
Let me
explain why?
Let me see if the other one gives you more. Withdraw from the study. Study participants are allowed to drop out whenever they want, regardless of the investigator's desires. Similar concept to prioritizing patient choice or autonomy, so long as it does not endanger the public or endanger a child, like in the case of parent refusing life-saving therapy for the child. So he has the right to drop out if he wants to, whenever he wants to.
Quitters gonna quit. Okay.
Sense? Yeah. Okay.
Yes. A 70-year-old man comes to the clinic because of 3-day history of fatigue, dark urine, decreased urine output, mild pain with urination, and a low-grade fever. He has gout, hypertension, osteoarthritis. His medications are allopurinol, hydrochlorothiazide, acetaminophen. Temperature is 100.2 degree Fahrenheit. Pulse is 88 per minute. Respiration 24 per minute. Blood pressure 160 by 95. Pulse oximetry on room air shows oxygen saturation is 97%. Jugular venous pressure is 7 centimeter of water. Cardiopulmonary examination shows no abnormality. Which of the following is the most appropriate next step in the management?
Ready?
Okay. Is it PVR,
It's C. Um, what is
measurement of PVR volume?
measurement of a pulse void residual volume. Um, when all men stop being so well, consider the poorly designed straw crusher, the prostate. Chronic outlet obstruction isn't so great, but it also predisposes to acute prostatitis, which in turn can further worsen said obstruction when the gland swells. First thing to do is see how much the gentleman is backed up, which in turn tells us if he has earned catheterization. All people and UTI go together like insertion, insert your own clever I don't know what that is. Okay, let's see here. Elderly men presenting with low-grade fever, dark urine, and decreased urine output with otherwise normal exam concerning for AKI. In elderly men, a common cause of AKI is postrenal due to BPH, which can be worked up with a bladder ultrasound. It will be important to discontinue NSAID in the setting of suspected AKI, but acetaminophen should be okay. Okay, so he has like a BPH complicated with an infection.
Okay, the key concern in this, the combination of dark urine, decreased urine output, and dysuria and low-grade fever strongly suggest AKI, potentially due to ATN, AIN, post-renal obstruction, glomerulonephritis, and urinary tract infection. And the option you choose, like IV administration of the fluid. The patient has decreased urine output and dark urine suggesting dehydration or reduced renal perfusion, pre-renal AKI or possibly ATN, secondary to volume depletion. Even with a normal JBP, his age, history, and current medication, hydrochlorothiazide, make him susceptible to volume depletion. Restoring fluid is often first step in evaluating and treating AKI, especially if pre-renal causes and are suspected and need to be ruled out. This can help improve renal perfusion and urine output. And the option C, this is crucial for evaluating post-renal obstruction, especially in older men. If there is a significant residual urine, it points an obstruction BPH, which would require catheterization. This is a very important step to identify and treatable AKI. You got it?
Okay, next.
Yes. A 52-year-old woman comes to the physician because of 2-day history of severe pain, markedly decreased range of motion in her right elbow. She has rheumatoid arthritis in her elbow, wrist, and hand. She reports episodes of moderate pain approximately 4 times yearly. Previous treatment with naproxen, methotrexate, and hydroxychloroquine has provided moderate relief. Treatment with prednisolone was begun after her most recent episode 9 weeks ago. She has not had generalized fatigue and muscle aches. She has no other history of serious illness. Her other medications are naproxen, prednisolone, and omeprazole. Temperature is 101, pulse is 90, respiration 12, blood pressure 110/70. Range of motion of the wrists and ankles is decreased. The right elbow is more severely limited by pain than the left elbow. There is warmth, tenderness, erythema, edema of the right elbow. Fine needle aspiration of the right elbow is compared. Gram stain. shows a leukocyte count 60,000 and no organism. Which of the following is the most appropriate? Ready?
Sure.
It is
Yes.
antibiotic.
It is wait, was it vancomycin? Yeah,
Septic joint.
vancomycin. That septic joint, joint, not rheumatoid arthritis. Rheumatoid arthritis, I guess, is a risk factor for septic arthritis, full-blown fever, and intra-articular pus. I think that's all. That's all. Let me see if the other one says something. A middle-aged woman with recent flare-up of rheumatoid who presents with fever and arthritis of the right elbow with joint type prevailing leukocyte count 60,000, most consistent with septic arthritis. Key ideas. Synovial fluid gram state only has sensitivity for about 15%, so there are a lot of false negatives. Most common organisms to cause septic arthritis is Staph aureus, and patients suspected with Staph aureus infection are often started on MRSA or antibiotics that cover MRSA like vancomycin. Okay.
Next.
Mm-hmm.
You wanna end here?
Up to you.
The next question is okay. Do that one is the biased. Just go forward.
Okay.
Let's see what can we do. Okay.
It's three questions.
Okay, then leave it.
Okay.
We will start from tomorrow in a fresh mind because
Okay.
I am very poor in biased still now. But
You
thanks.
cannot do that
But
anymore. You
but
spend